know that luckily Alginate cleans up really easy. So just with a dry paper towel, that comes right off, okay? You do want to make sure you get all that off though before you start mixing again, okay? So which goes in the bowl first? Water. Powder going in. Once it's all incorporated, you're going to start with the stroking technique, so using the side of the bowl. How am I going to load this tray? Right, all in one increment from the lingual, right? So you have that nice creamy consistency, texture. I'm going to gather it all up. Again, with the large tray, you're going to use almost all of it, or pretty much all of it. And in. You want to really make sure in this maxillary impression that you are not overloaded on the posterior, so you're not going to make it friends with your patient. I'm going to dip my finger in the cup of the water, make the indentation for the teeth. Let the patient know that I'm just going to put a little bit of material on their teeth. Again, make sure that you don't have too much in the back there. I'm going to let them know I'm going to place the impression. You might just feel a mouthful, might feel a little cold. I'm going to seat in the posterior, muscle mold as I'm bringing it up in the anterior, and then I'm going to ask my patient to tuck their chin all the way down to the chest. I usually do that as a rule on the upper because it does feel like a mouthful, and it's also going to help so that gravity's not going back. It's going to pull anything down, like out this way, okay? Obviously, he doesn't bend that easily, so just verbally say, I'll ask my patient to tuck my chin down into their chest, okay? And then just tell them to take nice slow breaths through their nose. You tell them they're doing great, you just reassure them, kind of make small talk. You can say, oh, you know, it's been really cold out there, or the weather's been great. Something just to kind of distract them, okay? Those are two things we don't talk about with patients.
Politics and religion.
Correct. People are usually passionate about them and they don't always agree, so no religion and no politics. Right? Stay neutral. So now again, I'm not pressing anymore. I don't have any pressure. My index fingers are just in there and my thumbs would be like up on their cheeks. Okay? If you try and take this from the front, you won't, like the angle, it's so awkward to try and seat. You need to be side and back, okay? Let's get in there. If you have extra in your bowl, you can always check that to see how that's setting. Usually if it's set in your bowl, it'll be set in the mouth because you have that warm temperature in the mouth, okay? It's just about there. I'm just going to give it another second or so. See how it's still, like my fingernail's still indenting a little bit? So we know it's not quite ready, okay? These trays are different. They have like a ridge on them.
Yeah, I saw that.
So one more second, I'm going to take that out. All right, so when I remove, you can come to the front. I'm going to protect the opposing arch. I'm going to try and give that one quick snap. If it doesn't come right out, I'm going to go up into the vestibule, let the patient know they might feel a little bit of suction. And you're going to go down and then come out on the angle, okay? And then my patient would have probably vomited all over me because they have all that excess in the back, which wouldn't normally happen again. You you do have that, you can just pull that right off before you pour, for sure. Okay? And then you inspect your impression again. You wanna make sure that you don't see blue, that you didn't overseat the teeth. You might sometimes, like this is not ideal. Do you see that like void right there in the vestibule? So depending what we were using this for, that may or may not require a retake. If we were making a bleaching tray, you really just need the teeth, so that wouldn't be an issue. But if it was for a denture or something, we might need to retake for that, okay? So you'll check and make sure you have the vestibule and all the other anatomy, and that you're good to go. Then what am I gonna do with it?
You're gonna
Rinse it, right, so I have my imaginary sink, I'm going to rinse it.
I have a question.
Yep, hold on, let me just, wait a minute, Jenny?
Yeah.
So I have that in there. I'm gonna slip my glove off. Glove spray. Get my glove back on. Wrap that up, and then in. And how long do I have before these are? An hour, right? Within 1 hour, you're gonna get those poured up, okay?